It's an absolute honor to be here this morning. Good morning, everyone. I am, as Sarah said, Deputy Secretary Ahrens, and I want to start today. I love the theme of this conference, and I want to start today just talking. I'll share a little bit of a story about something that happened with me earlier in my career, but I'll start by saying I've had the best teachers in terms of getting set up to do this job. And I think, again, in terms of the pandemic response, those teachers helped me. And those teachers were certainly people like Sarah. Teachers were self-advocates and family members. Those were the people that taught me the priorities for this job and what I should be doing. As I was thinking about this conference and the theme, the world around us right now, I wanted to focus a little bit on expectations. And what it means to have and set expectations and the sort of history of expectations that we have set for people with disabilities and how that's definitely been changing. We've watched that change over the last number of decades, and I think that continues to change and changes in a positive way, in the right direction. So I wanted to start with a story about a really valuable lesson that I had probably about 10, 12 years ago, something that my self-advocate colleagues taught me. So as some of you know, before I came to the state, I worked at the Temple Institute on Disabilities, and we had a large contract to do statewide training, peer-to-peer, so self-advocate to self-advocate and family to family. And my job was to coordinate that, which meant helping the family trainers decide, what we wanted to be sharing with other family members, same with self-advocates. And then ODP was very clear that the training had to be standardized, that we had to be presenting accurate information, and that we had to be presenting it in the same way so that people across the state were getting the same information from their peers, family members, or their peer self-advocates. And one of the ways that we did that is, we worked on all of the materials together, and then my job was to certify trainers. So we taught trainers how to present the material, and then I would observe and literally test trainers to make sure that they were presenting the information accurately so that we had that standardized curriculum across the Commonwealth. And I was criticized a little bit. I had some criticism that I was expecting unreasonable things from self-advocates, that, our system is super complicated, and, we had self-advocates teaching other self-advocates about waivers and the prioritization of urgency of needs and high school transition, all these things that are very complicated. We have more acronyms than anyone can possibly remember. So there's some criticism that those expectations were unrealistic. I guess I didn't listen to that a whole lot. I certainly sort of took it in, but didn't necessarily change a whole lot of how we were doing that. And I will tell you that, ultimately we had about 20 self-advocate trainers, and they were out across the Commonwealth training on everything from healthy relationships, preventing sexual abuse, employment, transition, waivers, et cetera, individual support plans. And that contract ended in 2014. And I will never forget, there was an evening where we had a gathering with these self-advocate, with all the family and self-advocate trainers, all of us that were involved in the training partnership. And the self-advocates got up and shared that, they shared that I had set very difficult expectations. They were very high expectations, but that I supported them to get there, and that was really an honor, and they were, proud of the work that they had done. For me, that was really one of the greatest honors in my career, was to hear the self-advocates say that. we literally, I think back to that time, and we had a trainer who was so devoted to that mission of getting good information to other self-advocates, that as an adult, she worked with her DSPs and taught herself to read as an adult. So something that had never happened in school, but it happened as an adult who was motivated and inspired to do that. So truly a great honor. And I think we know that, that again, for me was a really important moment for an honor, and certainly a learning moment for me in my career. But I think one of the things that we know this from classroom studies, is low expectations damage people. Setting high expectations, supporting people to meet them is really how to raise the bar. And we know better, so we should do better, right? We should be thinking about the types of expectations that we set for people. There is real bigotry in low expectations. So 2016, ODP adopted the life course principles. We adopted life course as a way we would approach providing services in the system. And this issue of expectations is one of the reasons that we did that. Again, if we think historically about the expectations for people with intellectual and developmental disabilities, what was expected in terms of life outcomes, we have often a history plagued with low expectations. So part of life course is changing that. Part of life course is we are looking for better ways to support families. It's an approach for our system to start raising those expectations, to be asking all of those questions about different stages in the life, and anticipating what we should be doing to plan for people to have those kind of rich, meaningful life outcomes throughout the lifespan. DD, intellectual developmental disabilities, autism, these are lifelong disabilities. And we need to support individuals and families to be thinking about all those different stages, what those different stages of life might look like, how to prepare for them, what are the steps that we can be doing to get people prepared to have a good life, what is a vision of a good life, and I would add, what is a vision of a good everyday life, right? That's the Pennsylvania spin on the life course materials that are adopted nationally, but I think it truly is getting that vision of a good everyday life. So when I looked at the conference agenda, I'm not going to talk a ton about the life course, the principles and the tools that go with it. I could see from the conference agenda that you've got lots built in to be learning about that, and I would really encourage that. It is something that ODP has been trying to embed and infuse throughout the system to really change our thinking and to be thinking about people over the course of a lifespan and raising those expectations and supporting people to get there, right? Laying that groundwork so that people can be successful with all of those critical things that make our lives meaningful. What the meaningful relationships, healthy relationships, employment, engaging with family and community in ways that really make people happy. So I want to talk a little bit. So one of the things that I think is challenging for us as a system in adopting life course is that even though we have since we started the waivers, we have more or less served people over a lifespan. Our eligibility was 3 and up. Now it is, as of 2017, it is birth through death. So we truly have a system where we can be supporting people over a lifespan. That said, we have primarily been an adult-focused service system. And that's for a number of reasons, including one of them is that Pennsylvania has very rich, our Medicaid services for people under the age of 21 we have a very rich benefit package under early periodic screening, diagnosis, and treatment, EPSDT. We also have a rich package of services in terms of behavioral health and mental health for children under 21. We also, as you all know, have a waiting list. So as we're sort of prioritizing resources, those have tended to get prioritized for adults who don't have that same access to school through 21 and the richness of those Medicaid services through 21. So we have, again, we expanded eligibility all the way down to birth. We have adopted this life course framework. So we are really trying to support people throughout that lifespan, even if it's not with services. That's very much part of the life course principles, is not thinking a service is an outcome, right? A service is something to help you get to an outcome. But there are lots of ways to support people through information and through other resources in the community. It doesn't always have to be about services. So we have beefed up the case management or targeted supports management that is available to people, and that we have a lot of work to do. I'm not saying we have arrived, but we have adopted that. And that is the trajectory, the course that we're on is trying to really improve that. We have added a number of services that are intended to better address some of the gaps that we know we have. So we've got all this richness in our Medicaid program, the EPSDT and the behavioral health services. Neither of those offer respite to families. And we know that there is a tremendous need there. Neither of those necessarily offer much by way of family support. So some of the things where we're trying to fill some of those gaps, we are trying to do through our home and community-based waivers. So trying to do it through better supports coordination, trying to do that through some waiver services that are really aimed at better supporting families. So we added some of the specific services that we added to better support families we added to our waiver services a family caregiver training and support service. We have added a number of sort of alternative therapies, art therapy, music therapy, equine therapy have all been added to the waivers since 2017. We expanded the number of services that were available for families, relatives to provide. So prior to 2017, we did not allow families to provide companion services, and we did not allow life sharing by families. So we have added both of those to things that relatives can provide. And during the pandemic, we expanded some of that even further, allowing families to provide residential habilitation. So that was a new option that's been available during the pandemic. We don't have a lot of uptake on that, but that was, we did even expand some of that during the pandemic. The other thing that we have tried to do is expand access to respite. And this is an area that has been incredibly frustrating for us at ODP. Not nearly as frustrating, I'm sure, for families who struggle to find it. We have tried changing payment. We have tried changing, some of the rules around respite, some of the provider qualifications. We've tried changing and tweaking a number of things to expand access to respite. And we're still hearing that people struggle to find respite. And that is a huge gap that I think our system needs to keep working to fill. Without that respite, families will be left struggling. It's such a critical piece of family support. So an area we will keep plugging away at. A couple of the other areas that I want to share, and this one is brand new, very exciting. We got on last Tuesday, I think it was. We've got approval from the federal government for our waiver amendment, which added eligibility for children with medical complexities who do not have an intellectual disability or autism. So this is, we have been working on an initiative to provide, again, we identified some gaps in terms of Medicaid and waiver services in terms of what families need. And for children with medical complexities, we had a gap here. We have a number of children with medical complexities who don't otherwise qualify for waiver services. Some of those children are living in congregate facilities. We want to make sure that their families have the necessary support to bring them home. we also want to make sure those same families have the necessary support so they can support a child without that child ever having to go to a congregate facility for care. So we added the eligibility to our waivers. We added a few services that we heard from families were going to be necessary to support those children at home in a family environment. And so those were just approved last week by the federal government. We'll be doing some training and getting news out, but it's really exciting for us to be expanding some of that family support to a group of kids and their families that desperately need it. So that's wonderful news coming here toward the end of the fiscal year. The one other thing I want to add is, as we have been, very focused on adult services, and we have a waiting list. So one of the things that has meant is we all also as a system often have sort of lost children between early intervention and high school transition. We historically have not had sort of automatic referrals for children coming out of early intervention to the county offices to determine eligibility for ODP services, which means until often for many kids historically, until high school transition, we don't know about them. So they don't have any kind of supports coordination, no connection with our service system. So we have a referral bulletin that is going out that is really about all of the other program offices within DHS making appropriate referrals to ODP. So when a child is in Medicaid and working with one of our managed care organizations, that managed care organization is making a referral. If the child, the family is involved with children and youth, that referral, if there's a known intellectual disability, developmental disability, autism, that referral is made to determine eligibility. That from early intervention, again, we make that same kind of referral, so that hopefully, again, we have that better ability to do that anticipatory planning, thinking about someone with an intellectual disability or autism over that span of their life, thinking through those life stages and planning for them, setting those expectations for a life that is rich in meaning in that everyday life. So we will keep plugging away at that. We'll get a training out shortly. That bulletin will be out, and there will be some training available for everyone in the field to hopefully start continuing to close all of those gaps so that we really do have a service system that is more responsive over the course of someone's life to all of those needs. So with that, I am going to stop, and thank you so much. Have a wonderful conference. Nice to see all of the names pop up here. Thank you.